So you've made the decision to have the procedure you've always wanted. You've spoken to those close to you, you've chosen your surgeon, and most importantly, you've chosen where you want to have your surgery, right here at the Chelmsford Medical Centre. So today is the day of your surgery, and your journey starts right here in the Chelmsford Medical Centre reception. Now, a few days prior to surgery, you will have had a pre-assessment with one of our nurses. Depending on the type of surgery you're having, this will have been conducted over the phone or face-to-face. Once you've arrived and registered with reception, a nurse will take you through your admission for surgery. So I'm here in the nurses' room with Jenny, who's part of the nurses' team here at the Chelmsford Medical Centre. Jenny, what exactly is your role and what happens in this room?
Well, in this room, we bring you in, we go through all your medical history, what you provided to the nurse beforehand to make sure that what you said is correct, and if you have anything more to add. We go through all your baseline observations, which would be your blood pressure, your heart rate. We weigh you, we do a body mass index with your height and your weight. We go through to make sure that you understand totally what's going to happen with your surgery. If everything's okay, then you go and speak to your consultant and anaesthetist, and they'll go through everything again with you.
On the day of your surgery, you'll have a chat with your consultant surgeon and your anaesthetist individually. The consultant surgeon will talk to you about the procedure and make sure you're comfortable with everything, and the anaesthetist will tell you all about your anaesthetic. You want to see the theatre you're going to be in? Follow me. The theatre where your procedure will take place. When you get in here, you'll be met by your anaesthetist, and today I'm chatting to Dr. Oakey. So Dr. Oakey, explain to me what an anaesthetist is and what exactly you do.
Well, your anaesthetist is a doctor who has spent many years specialising and training just in anaesthetics and gaining qualifications in anaesthetics. At Chelmsford Medical Centre, all the anaesthetists will be consultants in the NHS or equivalent. On your day of surgery, you'll first meet us outside, where we will come to you and take a history and go through any medical problems that you may have, any drugs or any allergies or anything that's relevant to the surgery. And then we'll explain what the various anaesthetic options are for your trip to theatre. That may involve a general anaesthetic. It may be possible to do your operation under a local or regional anaesthetic, but these are things, again, you'll have the opportunity to discuss before you come into the operating room.
So what happens when the patient gets in here, and what part do you play during the operation?
Well, here at Chelmsford Medical Centre, you'd be anaesthetised for your operation actually in the theatre where we are now. The first thing that happens is that you would have a lot of monitoring attached to you. That usually involves an ECG to measure your heart rate, a blood pressure cuff, we measure your blood pressure every 5 minutes during your operation, and a little clip that usually goes on your finger tells us what your oxygen levels are. So all that's introduced before the start of the anaesthetic and runs continuously throughout your whole operation until you're awake in recovery. So we really are monitoring every beat of your heart throughout your time under the anaesthetic. Once that's all on, we usually would introduce a small plastic needle at the back of the hand, although it may be possible for some types of surgery to have a gas anaesthetic if you would prefer. That's something you discuss with your anaesthetist on the day. Once the tiny drip is in the back of your hand, we usually squirt anaesthetic medicine in through there. You then go off to sleep within about 10 to maybe 30 seconds. And so we are there then continuously with you, monitoring your heart rate. We can control your blood pressure. Usually blood pressure is lowered slightly to decrease the effects of any bleeding during surgery. And we're making sure that your breathing is okay and that you're getting the right amount of oxygen right the way through to the end of surgery when you go through to our recovery room.
So I've had my operation, I'm still under the effects of the anaesthetic. What happens next?
Okay, when the dressings are on at the end of the surgery, generally we can go out to the recovery room, which is right next door to the theatre here. We are able to stop the anaesthetic drugs at that point. There's no sort of magic drug to use to wake you up, it just wears off naturally, and you normally come round within a couple of minutes of the operation finishing.
Well, I guess it's time to go to the first stage recovery room. So once you've finished in theatre, you'll be brought to this room, the first stage recovery room. Here you'll be attended to by an operating department practitioner known as an ODP or a recovery nurse. So Richard, this is the first stage recovery room. Can you tell me what happens to a patient when they're brought in here?
When patients first come out, they are still asleep, and they will be asleep probably for about 10 to 15 minutes after they come out. We put them on full monitoring. We make sure that they're hitched up to the oxygen and they're breathing nice and gently. And we leave them in that state. We do not give them any drugs or anything to wake them up. They wake up on their own. After about 10 or 15 minutes, before the patient's really aware of what's going on, we'll have removed the tube that they would be breathing through. And then it's just literally a case of waking up nice and gently, being made aware of where they are, because it's a bit of a strange place to wake up. We will keep monitoring them about every 5 minutes. We will then assess. Very rarely will patients be actually in any pain. If they are, we will assess that and do something about it there and then. It's more the strangeness of the environment, the fact that they may well have dressings and so forth that they're not used to, and it's just reassurance, general reassurance, making sure they're happy and comfortable, and they stay in here probably for about 40 minutes.
So how should I expect to feel at this point? Are there any other side effects of the anaesthetic?
You'd be feeling extremely sleepy, and that takes a while to wear off. You may also feel quite cold, although we keep you warm in the theatre, because the theatre is quite a cold environment. We would keep you warm in there and subsequently keep you warm in here, but you may have the shakes, you may feel a bit shivery, and that we will take care of while you're in here. Other than that, no, you should be fine.
So after you've been in the first stage recovery room, the next step is the second stage recovery room, and that's where I'm headed to now. Hello again, Jenny. Now this is the second stage recovery room. How should I expect to feel at this point while I'm recovering from my anaesthetic?
At this point you should feel very comfortable, awake. You'll have some refreshments in here. This room is shared with other patients. You'll have a nurse with you at all time.
So from this point, how much longer till I get to actually go home?
The second stage recovery is not long till you can go home. Probably you'll be in second stage for maybe up to an hour and a half, once you're comfortable with everything what the nurse has explained to you.
So what if I go home and I feel a little concerned, I just don't feel right? What do I do?
You have a mobile phone number that you can ring. You get straight through to a nurse and they'll advise you what to do.
So it's been a few days since my operation now. What happens next?
That will all be explained on your discharge. You'll be given a follow-up appointment. The nurse will phone you 24 hours after your operation to make sure that you're okay. If you have any questions, if the nurse has any concerns, we'll speak to the surgeon or phone you back a day later to make sure that the concerns you had on that day have been resolved.
Jenny, thanks so much for chatting with me today. I'm sure that the information that you and your colleagues are given is going to be of a great benefit to our viewers. After a procedure, and once it's safe to do so, you'll be discharged to recover in the comfort of your own home. Should you need it, you'll have direct access to an emergency number for a nurse and of course the full support of the Chelmsford Medical team. If you've got any more questions or want to make an appointment to see one of our consultants, call the number on your screen or check out our website for more information.